We've heard about the breathing difficulties that come with COVID-19. We're told it's one of the hardest things about the illness. Today, we learn why from a person who knows firsthand and a therapist on the front lines of treatment.
It's interesting because everybody thinks it's going to be the other guy.
What Mike Bruns thought would happen to someone else fell flat at his doorstep back in March.
Terrible, terrible fevers. I was up to 12 Tylenol a day just to keep the fever at 100.
The otherwise healthy 69-year-old was entering the onset of coronavirus. By the time he made it to Baptist Hospital, it was serious.
Well, the night before I went to the hospital, it was the first time in my life that I needed to sleep, but I was afraid to fall asleep because I thought, what if I don't wake up? That was how it was, because it's hard to fall asleep when you're just doing that kind of stuff, and that's where I was.
Larry Hopper is the systems director for respiratory therapy at Baptist. He says when patients start having breathing difficulties, it's often because of inflamed lungs that aren't getting enough oxygen.
You end up having a situation where the patient can't breathe that much, and it's very diffuse. One of the issues is it's not like localized in one part of the lung, but it actually is diffused all over the lung.
That's why supplemental oxygen becomes so important to ease the breathing and prevent the condition from getting worse.
As they progress and they get worse, you have a condition that sets up the stages for ARDS, which is very hard to treat.
ARDS, acute respiratory distress syndrome. He says it's one of the major causes of death related to coronavirus. At that stage, respirators and mechanical ventilators become critical.
It attacks the lung tissue. For some reason, it really causes that to be a major issue and a major cause for mortality with those particular patients. And it does it at a very fast rate.
He says having other conditions like COPD or obesity only heighten your problems.
Ventilating the patient, we really don't want to get to that particular point. So that's why it's so important that everybody follow the guidelines that's needed. We're relative to social distancing, taking care of themselves and not spreading the virus.
Mike Bruns says he was in good shape and had never been sick, but this illness hit him hard. And now knowing what it is like to have your breath taken away, he has this message.
Don't kid yourself, because I always thought the same thing. It happens to everybody but me, and it didn't.
Mike Bruns says he is now fully recovered from COVID-19. He has built up antibodies and is waiting to give blood.